This is Module 2, Meal Planning, Food is Medicine Curriculum. During the presentation, we will discuss what is meal planning in diabetes, and the different meal plan methods. So what is meal planning? Meal planning is basically deciding on what to eat and when to eat it. Anybody can meal plan. Meal plans can be as simple as having a plan for the day, or they can be more complex, like planning out a week or month of meals. So here are some helpful steps for meal planning. First off, you want to decide on a meal plan method, which we will talk about. You want to decide on what foods you want in your meal plan. Creating a grocery list based on the foods you want to eat can be very helpful. And then after you grocery shopping, try to prep vegetables and other fresh foods that take a little bit more time to prep, so you can have them ready for meals and snacks on the go. So meal planning and diabetes. Sometimes eating healthy is a lot and it can feel like a chore because you have to think about a lot of different things. But meal planning overall can be helpful and in the long run make it easier on you when you're deciding what to eat. Having diabetes and sticking with the meal plan can help you reach your blood sugar and/or weight goal. Meal planning for diabetes can also help you improve and maintain your cholesterol levels, provide an appropriate amount of calories, prevent, delay, or treat diabetes-related complications, and improve your overall health through optimal nutrition. Before starting a meal plan, it's helpful to know where you are, and by doing that, you're basically tracking what your food intake is, either in an app or a food journal. So we basically want to know where we are now. Testing your blood sugar before and after you eat can also help you better understand how effective your meal plan is. So testing your blood sugar 2 hours after you eat can let you know maybe how many carbohydrates you should eat for that meal. And below are some free food tracking apps. MyFitnessPal is a good one, Lose It, and MyPlate Calorie Counter. And these are all apps on your smartphone. So the different meal plan methods, we've got meals and snack methods, we've got portion control method, and the plate method. The meals and snack method. So this is basically spacing your meals and snacks at set times throughout the day. This can help blood sugars stay more even and help keep up energy levels throughout the day. Usually having a meal or snack every 3 to 5 hours works best for this method. So we're not going long periods of time in the day without eating. This helps to prevent overeating at a meal and keeps our hunger cues in line a little bit more. So below here you see an example of what the meals and snack method would look like. So having an 8 a.m. breakfast, you can start whenever breakfast is for you, but usually within 2 to 3 hours of waking, you want to have breakfast. 8 a.m. breakfast would be 2 eggs, 2 slices of whole wheat toast, and an orange. So you've got protein, carbohydrates, and then you have a snack at 10:30. So you have your apple would be your carbohydrate, and your peanut butter would be your protein. 1 p.m. you've got a lunch with a salad and a whole wheat roll. You've got a snack at 4:30. So you've got your mozzarella string cheese stick and whole wheat crackers. And then you've got your dinner, which would be your chicken, your rice, green beans, and tossed salad, and then you have an optional snack. So all snacks here are portion controlled, and they're meant to supplement the meals and give you more nutrients. So we're picking nutrient-dense snacks between our meals. The portion control method is the second method. And this is helpful if you're trying to lose weight and track your food intake. It's hard to know exactly how much we're eating unless we actually measure it out. Sometimes we are eating more or less than we should be or than we think we are. So measuring your food can help ensure the amount that you're eating is actually on target. And you can use this method by weighing your food, using a food scale, using measuring cups, or you can simply use your hand. And the one thing I like about the portion control method is that once you get used to weighing your food and you get used to seeing it on the plate, then you know how much you're actually eating. You don't have to weigh it out or measure it every time because you can kind of eyeball it after a while. So this handout is meant to be helpful if you're using your hand for portion sizes. So for example, the fist here would be about a cup. So a cup would be equivalent to a serving of raw vegetables or whole fruit, an ounce of cold cereal, or 2 ounces of cooked cereal, rice, or pasta. The palm of your hand would be about 3 ounces of a protein, so like a piece of meat, for example. Your handful, or like your cupped hand, would be 1 to 2 ounces of a snack food. The tip of your thumb there would be about an ounce or a tablespoon, so that would be equivalent to an ounce of cheese or a tablespoon of peanut butter. And then your fingertip would be a teaspoon, and that's what we use to measure oils, butter, mayonnaise, margarine, so more of the fats group. So that would be a teaspoon would be your fingertip. And then this is just some examples of portion sizes for our nutrients. So our carbohydrates, our proteins, and our fats. So the generalized recommendations for carbohydrates are at a meal would be about 3 servings at each meal. So you'll see listed here what an example of a carbohydrate serving would be, like a slice of bread, a third a cup of cooked rice or pasta, half a cup of corn, a piece of fruit, a cup of milk, and then the meats, choosing 1 to 3 servings per meal. So again, having the 3 ounces, the palm of your hand of a piece of meat would work for that. And then fats, 1 to 2 servings per meal. So these are just generalized guidelines. And the last method is the plate method. This is a method that's pretty easy to use and there's no measuring involved. You want to start with a 9-inch dinner plate and then putting on the appropriate amount of vegetables, starch, and meat, and then adding in a piece of fruit or a glass of milk, depending on how many carbohydrates you want to eat at that meal. So the breakfast plate looks different than the lunch and the dinner plate usually. Usually we don't eat vegetables for breakfast, but if you do, you're welcome to add those in. But a breakfast plate, we would want to have about a half a plate for the fruit, a quarter of the plate for protein, and a quarter of a plate for a whole grain. And the lunch and the dinner plate would be pretty similar. So a quarter for starch, a quarter for protein or meat, and then half of your plate, you want to make those non-starchy vegetables. So using the plate method for 3 meals with no snacks will provide you approximately 1,200 to 1,500 calories per day. Here's an example of the breakfast plate. So you see here you've got half a plate for those nice colorful berries, a quarter of your plate eggs, and a quarter of your plate is that whole grain English muffin. Here's an example of a dinner plate. You've got half of your plate carrots and broccoli, so non-starchy vegetables. A quarter of your plate is the salmon, and a quarter of your plate is the brown rice. So you might be asking yourself, which meal plan works best for you? And really, you are the only one that knows what works best for you. Keeping in mind that a diabetes meal plan is not a diet and you don't need to strictly follow it. It's just a way to choose the food you want to eat each day and provide you with maybe a little bit of structure and guidelines. So when you're thinking about which meal plan method would work for you, here are some questions that you might want to ask yourself. What are your blood sugar goals? How is your diabetes treated? Who plans and cooks your food? How much effort do you want to put into meal planning your meals? And how much structure do you like? Also, do you have a food budget? And what is important for you about food and meal times?